Hi everyone. I've been meaning to do a video on this topic for a very long time now. The reason being that we see this almost on a daily basis. So the topic is topical steroid dependent face. So the problem is very common actually, and if you start talking among your friends or the people you go to work with, you'll find at least one person who's been doing this. Although even we dermatologists, we came up with this word TSDF only a few years ago. So how many of you will admit to this? You have darker skin, you won't admit to looking for a fairness cream. You may say that you're looking for something to remove your tan or for a glow. You may start talking to friends, you may start speaking to your beauty parlor auntie, or you may go to the pharmacist. What are you people doing for fairness? Or you may go to the chemist and say, na, bhaiya, give me something for my pimples, I have blemishes or marks on the skin. And what does everyone say? I'll tell you, they would have say use Becnoate C, that's what we are doing, or Betamil GM, or use Panderm Plus, or use any cream that ends with LITE light, like a Skin Light, or BRITE bright, like UB Bright Fair, or Skin Bright Cream, or Lubate GM, or there's White Pearl Cream, and Melalite XL Cream. So, or you may go to I'm not talking about the bigger salons of course, the smaller parlors, and they will have this My Fair cream and Arabic cream. So they will say that these are Pakistani creams and Bangladeshi beauty creams. There won't be any ingredient list on it, but they're very cheap creams. They'll be like some 100-200 rupee creams. And they will even tell you that if you go to a dermatologist, the bill will come to 2,000-3,000 rupees. Nobody is going to become fairer or anything. The results will take a long time. Take this, I guarantee you in 2 weeks you'll become fairer. And they say it with so much confidence, and that kind of confidence and guarantee even dermatologists won't give, so you will be sold and you'll pick up the creams. You will also think that it's just 200-300 rupees for a tube, and if you're picking it up from a pharmacy, the pharmacist will even tell you that I'm not giving you Pond's or Imami. See, this is a pharmaceutical cream, this is made from pharmaceutical companies, skin doctors will also recommend it. So you'll think, what do I have to lose, and you'll buy it. So do you know where dermatologists will prescribe creams like Panderm or Quaditerm? Dermatologists prescribe these creams to treat absolutely nothing. So these creams, these are steroid containing creams. So steroids are usually given for short periods of time to treat allergies or inflammation. They are a kind of hormone. So because it's a hormone, when you start using it, and first and foremost, these creams should never be sold without a prescription, but of course in India you get everything without prescription. You will start seeing that within 2 weeks itself, your skin is looking fairer, it's looking brighter, it's shining. The fairness that you see with this cream is actually a side effect of the cream. As you keep using this cream, everybody will start seeing the side effects. You see that it is making the skin very thin, your blood vessels are starting to show, your skin is becoming very sensitive and dry and itchy. When you go out in the sun, your skin is getting very red and hot. You will see that the pimples that initially got better are now coming back even worse than before. As you keep using it longer, women who never had facial hair will start getting facial hair. Steroid creams also, there are many kinds, mild, medium, strong, super strong. For instance, Skin Light cream has mometasone, which is a medium strength cream, whereas Panderm Plus has clobetasol, which is a super strong cream. So if you've been using something like Panderm Plus for 6 months, 1 year, it makes you very prone to developing really serious infections on the skin. If you've been using it close to your eyes, eventually you put you at risk of developing cataract of the eye as well. What's the problem with these creams is they're very addictive. So people realize that it is starting to damage my skin, I'm starting to see side effects, but they're not able to leave it as well. They say, doctor, we have tried quitting these creams many times, but every time I stop this cream, my skin becomes so horrible and so red and itchy and sensitive. Again, if I use this cream for a few days, at least for a few days, my skin becomes a little bearable. So because of that, even though I know this cream is bad for me, I've ended up using it for 6 months, 1 or 2 years, and I've not been able to leave. If I leave it, even simple things like a Dove cream or a Dove soap will also start burning my skin. So this is the difficulty with it. When you come to a skin doctor, we have to start a de-addiction process. Think of it as any addiction that you're trying to quit. It is going to be a painful process. We'll give you creams to soothe the process and to speeden up the process, but it requires patience, it is going to take time, it's going to be a painful process, and it requires a lot of counseling and hand-holding. So what's the moral of the story here? Do not self-medicate and do not allow the pharmacist to replace the role of a physician.